Hello, it's Dr. Elisha Van Dusen with New Hope Chiropractic. If you feel pain, numbness, or tingling between your lower back and your leg, you're not alone. Sciatica, which is one of the most common forms of back pain, occurs in about 40% of the American adult population at least once in their lives, and it's often recurring over and over again. But sciatica is merely a description of a problem with a particular nerve, which could be impinged for all sorts of reasons. At a chiropractic office, a musculoskeletal health expert would be able to diagnose the most likely cause of sciatica and develop a treatment plan to aid the body's natural recovery with as little pain and intervention as possible. So, what is the sciatic nerve? Sciatic nerves are the largest nerves in the body. There's one in each leg, and they bundle together out of a multiplicity of nerves that emerge from the spinal cord in the low back. And then they run through the muscles of the pelvic region and down each leg until they typically split in two behind the knee. Each section then continues into the foot, and compression in a sciatic nerve can result in pain or loss of function along its length, but it usually occurs near its roots or as it weaves through the pelvis. How can the sciatic nerve be injured? Well, it can be compressed if the tissues surrounding it swell up after an acute injury, but it's really more common for compression to result from slow degenerative conditions, like, for example, sitting at a desk for too many hours a day. In either case, only one sciatic nerve would usually be compressed at a time. The sciatic nerve has 5 roots, 2 from the lumbar spine and then 3 from the sacrum, which is a little bit below the lumbar spine. And if one of the soft discs between the lumbar vertebrae is ruptured, its gelatinous center can bulge outward and actually compress a nerve root. A fracture in the joints connecting the lumbar vertebrae could also result in one of the vertebrae slipping out of place and pressing down on the nerve, or in the release of chemical signals even that would prompt the nearby muscles to swell and put pressure. So compression or impingement of the sciatic nerve can also occur further down if one of the muscles or tendons of the pelvis is frayed. The lumbar vertebrae are connected to the upper femur, that's the leg bone, by a deep wedge-shaped muscle called the piriformis. Usually the sciatic nerve sits or skirts around it, although in some people it goes straight through, and occasionally it divides in two and loops around it before pulling back and bundling back together. In any configuration, if the piriformis muscle swells and gets inflamed, it can impinge the sciatic nerve, and swelling in other muscles can also push the piriformis onto the sciatic nerve, making the problem even worse. So, as chiropractors, how do we treat sciatica? Well, as a chiropractor, I perform a variety of manual, range of motion, imaging tests to verify that impingement of the sciatic nerve is really the most likely cause of somebody's pain. And then my focus would be then to return to relieving pressure on the nerve through means like chiropractic adjustments and anti-inflammatory therapies. And usually adjustments can be done both on joints and on the soft tissues to move them back into place. And then also there are therapies like electric muscle stimulation, for example, or ultrasound that can be used to increase blood flow and bring fresh nutrients to injured muscles. So usually sciatica clears up within about 5 to 6 weeks, but preventing a relapse would require someone to put their spinal disc, joints, and hip muscles under less stress. That would usually mean building up the core muscles, be able to take on more weight or reduce the overall weight. And then stretching exercises too would also make the hip muscles less vulnerable to fraying. And then we can also provide advice on posture when standing and see that that'll distribute somebody's weight more evenly. So if you have sciatica or you know somebody who does, have them give us a call at 714-556-6966, or just book an appointment through our website at newhopechiropractic.com, and we'll be able to get you the help you need as soon as possible. And with that, have a healthy day.